Hey everyone, today we're talking about an important topic, epilepsy. A survey at Bustamante Children's Hospital revealed some eye-opening things. While parents and caregivers do seek medical help when their kids have seizures, many aren't fully aware of what to do during a seizure. The big issue is that most parents haven't received proper education about seizures. They usually get their info from the internet. Considering that 3% of Jamaicans live with epilepsy, there's a real need for better education. Here's a surprising fact from the World Health Organization. Up to 70% of people with epilepsy could be seizure-free with the right diagnosis and treatment. In this series, we're raising awareness about epilepsy. In this episode, I will explain what epilepsy is and what seizures are. Let's get into it. So, what exactly is it? Epilepsy is a long-term condition that affects the brain. The main thing about epilepsy is that it causes repeated seizures. Now, having just one seizure doesn't mean you have epilepsy. In fact, about 10% of people will have a seizure at some point in their lives. To be diagnosed with epilepsy, a person needs to have had 2 or more seizures that weren't triggered by something specific, like a high fever or head injury. Seizures happen because of sudden bursts of electrical activity in the brain. These bursts can happen in different parts of the brain, causing various types of seizures. Let's clear up some myths about epilepsy. First off, epilepsy is not contagious. You can't catch it from someone else. It is also not due to evil spirits. There are many reasons why someone might develop epilepsy, but for about half of the cases worldwide, we still don't know the exact cause. The causes we do know about fall into a few categories. It may be due to damage to the brain, such as during pregnancy or childbirth, due to head trauma later in life, such as from a car accident, as well as due to other conditions such as a stroke, cancer, or brain infection. It may also be due to other conditions not related to the brain, such as a serious infection and bad salt or sugar levels in the blood. Each of these factors can play a role in triggering epilepsy. Understanding these causes helps us work towards better treatments and support for those living with the condition. Here is another common question: how can we recognize seizures? Let's talk about how to recognize seizures, as they can vary a lot depending on which part of the brain is involved. While we often think of seizures as full body shaking and losing consciousness, there are many other types. Someone might have a seizure right in front of you in the office or class, and you might not even notice it. Seizures can cause temporary symptoms like confusion, unusual body movements, blackouts, behavior changes, strange feelings or tastes, lip smacking, chewing, or fiddling with objects. Children might stare into space or blink frequently, which can affect their school performance. Each person's seizures can look different, so understanding these signs can help us better support those living with epilepsy. Alright, that's a wrap for today. We've covered what epilepsy is and how to recognize it. I hope you found this video helpful. Stay tuned for more videos on epilepsy, including tips on how you can support someone living with it. Don't forget to consult your doctor for professional advice on this and other health topics. Your medical team is always there to support you. Remember, knowledge is the first step to wellness. See you next time.